Hello again and welcome to my YouTube channel. Today, this is my 15th YouTube video and I'm actually going to be talking about depression in children and teenagers in a little bit more detail. Some of you probably recall that I did touch on it back in video number 3, where I talked about the 5 most common mental illnesses or disorders that our children and teenagers can experience. My name is Tracey Maxfield. I'm a nurse, author, peer specialist, and staunch Stop Bullying and mental health advocate. And you can also check me out on my website, www.traceymaxfield.com, where I do a longer blog post that accompanies each YouTube video. And before I get down to business, just one more thing. If you press the buttons below, please consider subscribing to my YouTube channel, because I do record videos every single week, and with Oktoberfest approaching, I'll be doing a series of videos about bullying in children and teenagers. So let's begin. Depression in children and teenagers. So last year the Mayo Clinic released a statement about the specifics of depression with relation to children and teenagers. And they said that depression is a mood disorder caused by a persistent feeling of sadness and loss of interest. It's also called major depressive disorder, acute depression, or clinical depression. And basically it affects how we think, feel, behave, and can lead to a variety of physical and emotional problems. So basically you have trouble with normal day-to-day functioning, and sometimes you feel your life isn't worth living. And that is another reason why I felt it was important to discuss depression in a little bit more detail. Sadly, depression and NSSI, non-suicidal self-injury, and suicidal thoughts and the actual act of suicide tend to go hand in hand. And so I'm hoping that maybe if we can learn to understand depression in children and teenagers and identify the risk factors and then the signs and symptoms, we can get them help more quickly, thereby reducing their need to self-harm, but more importantly, reducing their suicidal thoughts and ideation, and hopefully prevent an actual suicide attempt. So I think what we really need to understand is that you cannot bring depression on yourself. It is an emotional disorder in the brain, and it needs long-term specialized treatment, specifically medications, especially in the early acute stages, and intervention by psychiatrists, psychologists. There is a need for therapy, absolutely, and counseling, and also lifestyle changes. I'm a great advocate of adopting a holistic approach to any mental disorder, but specifically for depression, because I too live with major depressive disorder, and during my very acute depressive episode back in 2015, which lasted for quite a long time, whereas I found that antidepressants and counseling was extremely helpful, it was turning to a holistic approach, really looking at my life from the physical, the spiritual, the cognitive, the social, the emotional perspective, that I was able to really move forward and get my life back on track. So it's estimated in the USA approximately 2.5% of children and 8.3% of teenagers have depression, and about 80% of children and teenagers are hospitalized every single year, not only from the depression or the self-harm, but also from because of their suicidal thoughts and suicide attempts. And it averages a cost of about $247 million per year. That's just hospitalizing teenagers. That's absolutely astronomical. In Canada, approximately 5% of males and 12% of females ages 12 to 19 years have depression. But this is what's very scary. It is estimated that the total number of Canadian teenagers ages 12 to 19 at risk for developing depression, just in Canada alone, is 3.2 million. That's, oh my goodness. And as we've already found out, just in the local media news and social media postings about suicide, it was Suicide Prevention Week last week, suicide is the second leading cause of death in children and teenagers ages 5 to 24 years old. So, what are the risk factors for a child or teenager developing depression? Firstly, any significant loss, such as the loss of a parent, a loss of a pet, loss of a grandparent, a pre-existing mental disorder such as conduct disorder, or maybe a learning disorder. We do know that children and teenagers with autism spectrum disorder, ADHD, attention deficit hyperactivity disorder, and OCD, obsessive compulsive disorder, are at an increased risk of also developing a secondary mental disorder, namely depression. A family history of depression and or suicide. A pre-existing illness, we do know that there is a connection between depression and diabetes. Other risk factors include repeated and prolonged bullying, breakup of a romantic relationship. How many times do we turn on the TV or read the news on social media to find that a child or teenager actually ended their life by suicide because they developed depression related to a breakup of a partner? Other factors, let's think back to ACEs, adverse childhood experiences or events, so traumatic experiences, abuse, neglect, a parent who is involved in crime or gangs, a parent who has a substance abuse. And so all of these increase the likelihood of a child or teenager developing depression. Now, lots of people argue that the signs and symptoms of depression in a child or teenager are very different from that of an adult. I think the most common signs and symptoms are true for children, teenagers, young adults, and adults. So I'll outline those first because they're the ones that are usually used when we have psychiatrists and doctors determining whether or not someone has depression. And so the most common are the persistent low mood, the sadness, irritable mood, a noted change in behaviour, a withdrawal from things and activities that they like to do, and a withdrawal from family. Significant changes in appetite and body weight, too much food, too little food, changes in sleeping habits, insomnia or just sleeping all the time but never feeling well rested and always feeling tired and exhausted, loss of energy, difficulty thinking, problem solving, concentrating, feelings of helplessness, of hopelessness, of worthlessness, moody, irritable, agitated, but unable to explain why, and thoughts of death or suicide. And what the general consensus is that if 5 or more of these symptoms have been present every day for a minimum of 2 weeks or more, then they do additional testing to determine if in fact the child or teenager has major depressive disorder. Now there are a number of tests. One of them is the Beck Inventory Scale, and on my blog post, which will be posted on my website, I actually go into more detail about the specific assessment tools they use to help children and teenagers who may have depression. Other signs and symptoms which may be a little bit more confusing, because when I read them out, you're going to think, well, kids and teenagers are like that. But I think you need to take them into consideration because they could be underlying reason for this change. So for example, what you'll notice is there's a change in their appearance. They'll have outbursts of shouting, screaming, crying, being frantic or being very anxious, and this is very atypical behavior. You will say something is not right. Extreme sensitivity to failure or rejection, increased social isolation. You'll notice that there's a change not only in their appearance but maybe in their body language, their communication skills, even in their personal hygiene, whereas they may not be taking care of it. Other complaints is that their schoolwork, they're failing grades. Teachers may comment that they're just not concentrating or paying attention, and there may be actual frequent absenteeism from school, either with the child or teenager not wanting to go to school because they do not feel well, or actually skipping school, playing truant. Other signs and symptoms which are more specific to children and teenagers is maybe a child will become unusually clingy. They may start expressing a fear of death and dying, being alone, and they may even talk about running away from home. Also, you may notice that they're engaging in risky behaviors, more reckless behaviors, and they are moving with a different crowd. Look at their friends. What are their friends like? What are they up to? Please also take a look at if alcohol or medications are missing. Many of them will turn to self-medication, especially with the use of maybe prescription medications you have in the home or alcohol, to try and deal with the feelings that they're having, especially this overwhelming sense of gloom and hopelessness and sadness, and they want to feel happy and upbeat and be just like their friends. And so that is another notable risk. And I think also we need to look at, when we look at their clothing, are they suddenly wearing long pants and long sleeved clothing to conceal their limbs, and the weather outside maybe is a little bit warm? There could be signs of self-harm, because as a means of coping, kids, especially those with depression and an anxiety disorder, will choose to self-harm. So treatment, obviously, the child or teenager must go and see a doctor, must have an accurate assessment and any diagnostic tests that may need to be done. For example, they may do blood tests just not to determine that maybe there's not an infection or maybe an anemia, because anemia does also present as depression. Then once the diagnosis is confirmed, it's very high likelihood that they will initially begin in antidepressants. And I'm actually going to talk about that in more detail later on, because up to 40% of kids find that they have treatment-resistant depression, so I will discuss that. So medications, usually SSRIs, that's a mouthful, for depression. Psychotherapy, cognitive behavioral therapy, CBT, is found to be extremely helpful, including talk therapy, and then family therapy. And with children, they've actually found that talk therapy and play therapy is helpful. Again, let's talk about a holistic approach. Healthy diet, exercise, fluids, creative means of self-expression, music, building, art, poetry, journaling, expressing gratitude. Meditation is very helpful, mindfulness. Youth support groups may be helpful. Reduced time on social media. We are finding that increased time on social media when a child or teenager has depression can actually promote more sense of hopelessness, worthlessness, and may actually lead to self-harm, may lead to the development of another mental disorder such as PTSD or anxiety accompanying the depression. So I think as parents, it's very important that you actually be there for your child or teenager and listen to them. And the listening is non-judgmental, not discounting their feelings, validate what they're going through. Do not tell them, oh, smile, it'll get better, you're just going through a stage, it's hormones, just be happy, get out there, do something. This actually does not work with someone with depression. I can attest to that personally. So you need to be patient and understanding, and you need to show love. Also, I think you need to ensure they follow the treatment regime. If counselling is a joint venture with family and the child or teenager, then follow through on that and observe their body language. As I said, look for the signs of self-harm, maybe who their friends are, alcohol, drug abuse. Other thing, follow up with the school, discuss the plan of care with the school, and if you have other family and friends and siblings that are aware and want to get involved, then you work together as a team. This is the most important thing. This is not something you face alone. You work together as a team. Promote the safety in the house. Remove drugs, alcohol, firearms, toxic chemicals, because suicide ideation and thoughts unfortunately go hand in hand with depression. And then encourage your child or teenager. Life with depression is really one step at a time. There will be good days, but then there will also be bad days. And I think an important point is when you have a bad day with depression, it's a really bad day. So you need to be there. Never ignore the behaviour, tease, blame, invalidate, ridicule. And then together establish a daily routine. I found, and most people with depression have found, is establishing a daily routine not also keeps you moving forward, but it helps pass the time. It's a form of redirection, and it also gives the child or teenager a sense of purpose and a sense of control, because with depression we all feel like we have no purpose and we've lost control. So even taking off tasks that you've agreed upon will give them that sense of control and that confidence that in fact they're getting things done and they are moving forward. As a parent, please observe their behaviours and body language. Be cognizant, and also look if they're having any side effects from the medication. If they are, you need to follow up with a physician and do not just stop treatment. Follow up with a physician and discuss the next plan. And so now let's review treatment-resistant depression in children and teenagers. As I've said, up to 40% of children and teenagers do not respond well to antidepressants. And I think the challenge is when you've struggled with trying to find the right antidepressant for your child or teenager, teenagers especially after about the third trial will say, I'm done, I don't want to do anymore. And that's when they turn to drugs and alcohol as a way of dealing with the symptoms that they're experiencing and the emotions that they're trying to deal with. I mean, as a teenager, it's difficult enough as they try to find their independence and show that, you know, they are capable and that they don't need parents to help them and they can do their own thing. Add in depression to the equation, this is really difficult. Also, I think as a parent, I need to point out, if you think the depression is related to bullying, you need to go to the school and you need to talk to them and deal with it. So I'm going to talk briefly about 3 specific treatments they're now reintroducing, and the FDA have actually approved them as treatments for depression in children and teenagers. So the first one is ketamine. And ketamine is actually an anesthetic, and it's also a street drug, and it's used on the streets known as special K, so it's a controlled substance. What they have found is that ketamine actually activates the part of the brain that regulates the emotions, and within like 20 to 30 minutes of administering ketamine via a controlled IV infusion or through the nose intranasal, that children and teenagers have a reduction of the thoughts and feelings associated with depression very, very, very quickly. And in fact, lots of them can continue their activities in a very short space of time. An alternative to ketamine is ECT, electroconvulsive therapy. Now, if you remember, this was very, very popular back in the 1950s and 60s, and it's really had a bad rap because you think of One Flew Over the Cuckoo's Nest. ECT therapy is actually more refined today, and what some doctors are actually doing is using ketamine in conjunction with ECT therapy on teenagers, and they're finding that it's actually yielding positive results. The actual procedure is tolerated easily and the side effects are minimal. And what they're finding in studies is that teenagers who had severe treatment-resistant depression went into remission and were able to resume their pre-depression activity almost immediately. So that's another thing to consider. And then the final treatment is CBD oil. And as you know, talk everywhere about CBD oil lately. So first of all, let's talk about CBD oil. So in the marijuana plant, there's two compounds. So the THC is the psychoactive part, that is the get high part. The CBD part is the not get high part, and that is the component that's now been introduced into gummy bears and food and oil. And so it's believed that the CBD oil can lessen the effects of the depression and increase happiness by interacting with the endocannabinoid system. That's a collection of receptors such as serotonin and dopamine in the brain, and the corresponding molecules called agonists, which help regulate mood, pain, pleasure, sleep, appetite. Now, CBD oil has been found to be very helpful in the treatment of ADHD, epilepsy and seizures, but no long-term research has actually been conducted into its effects on depression and anxiety. So I think, again, we need to tread very carefully. If you have a child or teenager who has treatment-resistant depression, or you're now looking at trialing a third or a fourth antidepressant, talk to your psychiatrist about ketamine, ECT, CBD oil, and see if it is something that they think is an option worth considering. Any of these treatments, alternative treatments we will call them, must be done under medical supervision. For example, the administration of ketamine is done in a supervised medical setting, because when the drug is first administered, they can have some really weird adverse side effects, because they will go through a temporary high and have hallucinations or delusions, and so they need to be guided through that. Of course, by the time they leave the clinic, then they're okay. But I err on the side of caution. Talk. Do not just order CBD oil online and start giving it to your child or teenager. Talk with a medical profession first. Weigh the pros and cons, and then work on the next plan of care. So I hope you found this video helpful. Please go to my website to find the blog post, which is in a little bit more detail. It explains in more detail what happens to the brain when you take ketamine or CBD oil. Also, I've listed the screening tools for depression, and you can actually go online with the links and print them off, complete them yourself if you think your child or teenager has depression, and then take them with you when you go to the family doctor or the psychiatrist. So next time, as I mentioned earlier, I will be discussing bullying. It is now Bullying Prevention Month, and I'll be talking about the very different aspects of bullying and what you can do to help. Thank you for your time.